Welcome everybody, and I am so happy to be here with you today. My name is Karen Guggenheim. I am CEO, founder of the World Happiness Summit and WAHASU. The goal of our organization is actually to bring the amazing work and science that you all dedicate your lives to, and to bring notoriety and promote the practical implementations behind the science of well-being. And we do this to a global audience. We bring an expert community with and gather with thought leaders, members of NGOs, government leaders, and the public at large. And so for me, it's such a privilege to be here. Thank you, Jan, for including us. And also to be here with this amazing panel of doers. They are the ones that are on the grounds and creating such positive change in the world. And so today I was asked, are you optimistic about the future? And I have to say that I am. And although my personal life has not been all flowers and have experienced the personal trauma and loss, I can tell you that because of people like this who are here today, there is a lot to be hopeful for. Certainly life is not perfect, will never be perfect, but there are so many initiatives that are evidence-based that are happening today. So I am so honored to be with Jonathan, Dexter, Sue, and Mark, who will share about their different initiatives. So Jonathan Rose, he's a leader in the integration of business, public policy, and nonprofit work to create environmentally, socially, and economically resilient communities. Gosh, if we can be anything, let's be resilient. And he is the author of The Well-Tempered City. I am so excited to hear from you about the initiatives that you are leading, and perhaps you can share some of the challenges and then some of the opportunities that we can see to create better communities that are engaged for well-being.
Well, thank you, Karen, and thank you all for being here. It's been fascinating. I founded and lead a company that builds affordable housing throughout the United States, and we buy existing affordable housing and transform it. And our view is that a safe, green, non-toxic, affordable housing is an essential platform for well-being. It is necessary but not sufficient. There is such a housing crisis in the United States, and by the way, in many other countries of the world, that there's an enormous pressure simply to provide the housing. And we recognize that that's completely insufficient. We have a model we call developing communities of opportunity, and we say that this housing has to be integrated with on-site health care, access to job training and jobs, mass transportation, access to healthy food, after-school education, computers, digital access, a whole series of things that together, if you study the social determinants of health, we know are the necessary conditions to create, to move people ahead in their lives and do what we call creating opportunities. And then the other thing we know, which has also been so much part of your work, is that you have to build a trusting community, you have to build a connected community. People have to, that everything we're talking about is a relational subject. We actually live in a world, if you think about it, our economic world was constructed often around the idea of individual maximization, but our theory is we're really looking for collective optimization. We do this in two ways. We build amazing new projects. Our projects are often models of the future that we want to create and then are getting duplicated. So for example, we have a project in East Harlem today that is 700 units of mixed income housing, housing families from formerly homeless to middle income. It is the greenest, it's built to a standard called Passive House, which is a German standard, super green. The green is very important not only from an environmental energy point of view, but also non-toxic point of view. Many low-income children, for example, miss school because they have asthma. And so we know that when we create green environments, we're using non-toxic materials, there's a much higher school attendance rate because the kids are much healthier. Then we also know that low-income kids often lack access, digital access. Their parents can't afford the internet or are not sharing the internet and can't afford devices. And they're not living in a digital culture. So that's another thing that we're bringing the kids. And then another thing is after school education. Many wealthier families have tutoring, or they have the kids are taken to a library, they're in a culture of reading. And so we're trying to create those things. And what we're looking at is then not only what are these individual actions, but what are the interdependencies amongst them. And so we've put together a research consortium with Harvard Chan School of Public Health, the Columbia Mailman School of Public Health, Dartmouth has a health economics group, Enterprise Community Partners, and NeighborWorks, 2 national not-for-profits. And this group of 5 have now received a large grant from the JPB Foundation, so we're studying the efficacy of this work. What's interesting about it, though, is there's another thing that we've also talked a lot about today and yesterday, which is empowerment, and that people need to feel empowered to have a sense of the future. So all these programs that we do under a model called co-creation. So we alone are not deciding what the work will be. There's several people, the residents themselves are deciding what they'll be. And also we do it all in partnership with local not-for-profits, local healthcare organizations, hospitals, et cetera. And so it all depends on what's available. So for example, if there's a great after-school program in education, we can bring it to our housing, but if there isn't one, we can't. So it requires an ecology of action. So I just want to tell a brief story, which is we had a project in inner city Newark, about 1,000 people living on a block that we bought that was, so I think I mentioned we both build new, but we also buy existing affordable housing, which is often those big concrete ugly buildings in places that most of you would not want to live, and then we try and figure out how to transform them. And we had heard that what the teenagers really wanted was a basketball court. And in conditions like that, basketball courts are about the most dangerous thing you can do because that's where gangs get together and fight, and it's generally not a good circumstance. But we'd committed to this idea of co-creation, and so we turned to the community and said, we're going to invest in what you want. And I held my breath because I was really afraid, but it turns out they all got together, and what they said they wanted were arts and education programs, because those had all been cut from their schools. And so we partnered with the Newark Symphony, the Newark Art Museum, and a whole series of amazing cultural programs in Newark. We brought these amazing arts and education programs that the community was really woven around it. Every elderly person then had like the story of their life on their door, their apartment, all kind of made out of, anyway, all this amazing stuff. And after 5 years of this amazing community building, one day we turned to the community and said, hey, would you guys like a basketball court? And they said, yes, and now we have this very friendly, peaceful basketball court. So anyway, the point is that, my last point is, so when it came to research, I mean, here we're trying to do this research that'll compare the efficacy of our work, that has got to be a gold standard, it's got to be double-blind and compared and all that stuff. So the challenge we have is, how do we co-create this? Because we're saying to the residents, you get to co-decide what we're going to research, because we're asking you to participate in it, which means the research is going to be different in every community. We think that there's going to be really meaningful output that comes from that. And the reason I raise that is that I suggest that in the subject of research about well-being, sometimes we squeeze the subject matter into a model to try and get the most accurate outcomes, but sometimes we lose things in that squeezing. And so I think we have to be just careful as we think about research design.
Excellent, wonderful. Those initiatives are amazing, and I just love the idea of bringing so many different partners together, because that is true community building. That's much of the work that you do, Dexter. As president of the Blue Zone's Wellbeing Institute, you're responsible for the strategy and solutions within the Wellbeing Division to empower individuals and organizations and communities. I'm particularly interested about this living lab to create and codify best practices, including lifestyle medicine. I know you're a physician, and so I'd love for you to share with our audience about the initiatives that you're doing, and also the partnerships that you are collaborating with to make this possible.
Well, thank you for that. Yeah, it's interesting because we're talking about best practice. So a lot of the things that Jonathan just talked about are also things that we're involved in as well. So Blue Zones, for those who may not know, is really about research. That's where it really started. And Dan Buettner and National Geographic, National Institutes of Aging, went around the world to find the fountain of youth. And what they found were 5 communities in the world where people tend to live very old, centenarians. They live to be over 100 years old, and they're healthy. They don't have the kinds of diseases and chronic conditions that we would imagine people at that age would have. And they're happy too, right? And so what they found, these different communities were all over the world. There was one in North America, but there was one in Greece and Japan, but they had some common elements. They had 9 elements that we call the Power 9. And so the idea was, can you take those common elements, re-engineer them and put them in other communities and get similar results? And so that's the track that we've been on for a number of years now. We're now in 72 communities just in the United States alone, and we're replicating these models. And it's been very successful, and we have found things that work, and I can talk about challenges as well, because there are always challenges. But one of the things that we do is that we really need to make sure that those communities want to change, that they're doing it for reasons that are important to them, sort of as what you were saying. We go in, we talk about doing an assessment. Where's leadership? Is leadership on board? And it's not just one segment. It needs to be government, but also employers, communities. So we want to have a critical mass of leadership that's on board. We can then do this assessment. Where is that community? And we ask the community, what do you want? What does success look like for you? So every community is a little bit different. We have hundreds of policies, hundreds of things that we know can work, but each community is a little bit different, and so not every community will reach for the same kinds of things. All of those things are based around changing the environment. When we talk about changing the environment, we talk about doing it for people, places, and policy. And policy is actually the wrap around all those things. So for individuals, we may make some changes in their home environment. Places where they work, we might make some changes in the work environment. Community environment, those kinds of things. But all of those things might require a bit of policy. One of the things that we were talking about before we got started is that some of the things that we do in the Institute now is we're trying to put health systems and what they're trying to achieve in those communities along with what the community is trying to achieve for itself. That's not done usually in the United States. But then you think about policy, it's not just infrastructure policy, but it's also reimbursement policy. So we're now running some randomized controlled trials around food as medicine and actually seeing how do we embed that into the benefit design so that now that gets to, thinking about food and sustainability in a different way because we're actually now able to pay for it and incentivize it the same way you would a generic drug in some instances. So those are some of the things that we're doing. Now, in terms of challenges, anytime you deal with people, you have challenges. And so you have to, we're really built on forming coalitions, working together. We're very proud of the fact how we bring people together. But anytime you have to do that, sometimes it's a slow process. And I will say that our programs or projects are anywhere from 3 to 10 years. So it's a long-term commitment, but it gives us time to bring these coalitions together and really look at some outcomes. Our outcomes, we look at the Wellbeing Index as one of them. But again, we also look at healthcare costs, given that we're in the United States, and that's very important. And what these organizations have seen is that as well-being goes up, healthcare costs go down. In some of our communities, we've seen as much as a 40% reduction in healthcare costs. That's important for these communities, particularly those that are self-funded. If you think about municipalities, they can use that money to reinvest into the communities. So it's a win-win when we look at it that way.
Love that. It makes me think of almost like a well-being piggy bank, right? Mm-hmm. So you can take the cost savings, put it somewhere else, and invest in these amazing programs. And using the data, you're really making a case for well-being. And I think using the language that leaders understand, which brings me to to Sue Polis. Sue directs the Health and Wellbeing portfolio for the National League of Cities as part of the Institute for Youth, Education and Families. She has expertise in health policy and spans the connection of housing, economic opportunities, mental health, substance use disorders, obesity, trauma, and local systems alignment and data for well-being. That is a lot, and what is really exciting is how you empower and support government leaders on a city, village level to make this, this data available so that it can take actions and improve the communities in which they operate. So can you share more about the initiatives that you lead, and then how we can improve well-being perhaps in some of these localities?
Thank you, Karen, and what a pleasure to be here today with so many experts talking about something exciting like well-being and improving holistic well-being. As Karen said, I work with the National League of Cities, so our journey really is to walk alongside local elected officials, mayors, city council members in the U.S., and try to really help them as they work to address some of the challenges we've been talking about the last couple of days, right? So whether that's housing, infrastructure, a range of issues, including homelessness and mental health, so many of the things we've been talking about. And so as the health and well-being portfolio, right, our work is really to help connect those challenges to health and well-being, right? And so developing that lens. And the data, especially some of the dashboards, the well-being measures we've been talking about, are essential, right, to mindset shift. If we're going to transform communities, the data, and we've heard this from Republican and Democratic mayors and city council members, the data demonstrates, right, where those concentrated disparities are. And so it's unifying in the sense that you can see quite plainly, right, in zip codes across the country where those concentrated disparities are, which every city has. And so we designed it with the support of the Robert Wood Johnson Foundation. Of course, Alonzo and Claire are here. We've developed what we call cities of opportunity. And the design is really to meet the cities where they're at, because as we said, local context is different. State environments, right, are quite different in the US. So you can have a great policy idea locally, but it can be preempted by the state, right? And so a lot of our work is to apply capacity building and intentionality, right, around these issues that are so systemic. And when I read Jonathan's book, I thought, wow, somebody's really thought about this extensively and has studied cities from their evolution. It was fascinating read. And I thought, wow, this really reinforces why cities of opportunity, communities of opportunity, it doesn't matter what you call it. It matters that we're really walking alongside and supporting cities, because when we talk about data, when we talk about systems alignment, who trains for that? You don't run for public office because you want to work with data and do systems alignment. You run for public office because you want to solve the problems in your community. And so expecting that cities have that capacity, even though everyone wants communities doing the policy work, is really the nexus of our work, right? And so we build the muscle. We help cities build their capacity. And it all starts with data. So last year, Jan and I were able to partner with the support of the Robert Wood Johnson Foundation, with John Baer, who at the time was with the Blank Foundation, now with the Templeton Foundation. We got to partner and really sort of look across US cities. What's happening? What are they doing? And so we found several examples of how cities are using well-being measures. They don't call them well-being measures. They call them equity measures, because it's all about having enough data on the factors that influence health and well-being, right? So our housing, our transportation, right? Our economic opportunity, our schools, our access to early childhood programs, right? It's not one of those things, it's all of those things. So just as an example, Tacoma, Washington, which some of you may be familiar with, they have an equity dashboard. And that gives you a great picture and really supports mindset shift and brings people to the table. So we help them bring those sector partners to the table. And then we help them apply the data, right? Because that high level data is essential to building the table. But it's not enough to inform policy design, right? And so what we've done, like with Tacoma, we talk about a livable wage. Well, what is that? So we help them through our data define a livable wage, which in Tacoma, Washington is $24 an hour. And then they said, okay, we know what the livable wage is. What's the sector growth in the city? It's healthcare, because through COVID, the demand was so high, right? So they knew they wanted to support workforce training in healthcare, but then to what end, right? And for who? And so they looked at their data and they identified 2 communities with very high numbers of concentrated disparities in education and income and health. And they talked to the communities, and they started a pilot, an earn and learn pilot, is what they call it. And the community, right, the Salishan community is where they are starting. And so not are they just supporting the workforce training, because they spoke to the community, and the community said, it's wonderful to have this kind of a pilot, but what we really need is cash and housing as we're in the pilot, because how do we survive, right? And so the workforce board supported the stipends for people to participate. They're using their American Rescue Plan Act dollars, which is a federal policy that enables local cities to define how they want to use those dollars. So they're using their ARPA dollars to support wraparound services, and the Housing Authority is providing the housing. Now, this is a pilot, right? So they're evaluating it, and the goal is to hope to grow. But those partners were around the table. What catalyzed this braiding and blending of funding and systems alignment was the data. But the data itself doesn't do the work. It's the ability to analyze and apply the data to the policy mechanism. And so if you ask me, what's the greatest need? We need model policies that can be applied based on local context and state environments, because it's not enough to just put the policy out. It has to be co-designed, co-created with the community. And so, that's really the genesis of the work and what we're doing.
Fantastic. It's almost like having a subjective well-being of cities, right? And how it's adaptable to each one. I also really like how you've been able to do something quite difficult, which I think is to bring local policy to the federal level, which is very challenging. So congratulations on that. Mark Williamson is a co-founder and director of Action for Happiness, which is an amazing organization that also Richard is very involved with. And it's really about co-creating a happier, kinder world, and also decreasing misery at the same time. So I think it's wonderful how you have been able to create these communities in these circles to empower people and co-create opportunities where people can feel better, and also bring in the data, right, and to make it actionable. I just love the name of your organization, Action for Happiness. I think it's brilliant, and it's so down to earth and practical. Can you tell us more about, and especially what's happened in the last 2 years, because I know that there's a lot that's happened in the circles.
Thank you, Karen. That's a lovely introduction. It's lovely to be here with you all. Can you hear me at the back? Give me a wave. So yes, Action for Happiness, one of, I don't know if it's but certainly one of the biggest communities of people taking action towards global well-being. We have had our resources used by tens of millions of people, and we have 300,000 members in 190 countries. So, well, actually, before I say a bit more about that, I'm conscious that we're at a Wellbeing and Research Conference, and there's been a lot of thinking, a lot of intellectual incredibly inspiring conversation, but there's been more of the research and policy and less of the well-being. So I'd like to invite you all to join me for 30 seconds of well-being before we talk a bit more about the thinking. So pop your phone down or your laptop down, whatever you're doing. Maybe just take a moment just to take a breath and just maybe tune into how your body's feeling right now. Take a slightly deeper than normal breath and just notice how you're feeling. Just bring your attention to that lived experience of what's happening right now, without any kind of judgment, just noticing how you're feeling, both physically, but also what's the weather pattern like inside? How are you feeling emotionally right now? And then I'd like to invite you to bring to mind one thing that you're grateful for right now. It could be a really big thing, a major achievement, a fantastic recent success, or it could be a tiny moment, a friendly smile, the sunshine, a conversation, an idea. Just bring to mind something that you feel grateful for. And then as we return back into the room, maybe just take a moment just to have a little stretch and move your body physically a little bit as well. We know that all of these things, being mindful, being grateful, being physically active, and also, I nearly hit you in the face there, apologies, are all great for our well-being. But the point here is that actions make a difference. Of course, the systemic policy, international, national, local government action is vital, but also our individual actions make a difference. And actually, crucially, together in communities, we can really transform our own well-being and affect the well-being of others around us. So in Action for Happiness, we talk about happier, kinder, together. So happier is about we can take action to improve our own well-being. Kinder is about we can actually take action to help other people improve their well-being in really tangible ways. And the together is twofold, really. Firstly, it's both of those things are interlinked, that when we're good to others, we feel better, and also, when we feel better, we're more likely to be kind to others. But the together is also, as Karen was alluding, the bringing together of people. This is where we can transform our well-being. So to give you just two examples of what we've been doing with Action for Happiness globally, we have a calendar, a monthly action calendar with a theme that anyone who knows about behavioural science would know is a terrible idea, because it has basically a single action every day to improve your well-being. And people don't like prescriptive lists. Nobody can possibly do all of them. As a behavioural intervention, it should be an absolute disaster. And yet this has been downloaded and used by 35 million people now. Every month follows a slightly painful alliterating theme, from Active April and Meaningful May through to Joyful June and Self-Care September. They're all grounded in the science, all the great research that you and many others do. But they're making it practical. They're reminding people that the actions they take can make a difference for themselves and others. So the reason a calendar works, we think, is it's very simple. They go up on school notice boards, they go up in workplaces all the time, they're shared massively on social. They're thematic, so you feel part of something bigger. But the idea of the calendar and a small daily action is that the things you do can make a difference for your well-being. So that's a sort of at the initial interaction level, very high level. Of course, to really transform well-being, we need to go deeper. So we have volunteers all across the UK initially, and now all around the world, running activities that bring people together face-to-face, particularly a course we developed, the Action for Happiness course, which people get together for a number of weeks, and they learn some of these skills together. They talk about them, they understand the research, but crucially, they put it into practice. They have conversations together. They go away with an action plan for themselves that they've thought of, that this week I'm going to try and meditate every day. I'm going to visit an elderly neighbour who may be feeling isolated. I'm going to just try and go to bed slightly earlier, or be kind to my spouse, whatever it might be. And they come back the week after and they talk about how that's been, and they share together as a group. And they say things like, oh, you feel that way too. And actually, this has made a really big difference. And so we knew it was working anecdotally, but we wanted to find out. So we, with great support from some academics like Jan de Neve here and others, a full randomized control trial was done of this intervention. And we found that it had really substantial benefits. 1 point on the 10-point scale of life satisfaction maintained many months after the course, big reductions in depression and anxiety, and crucially, what I'm most pleased about is big increases in pro-social measures like social trust and compassion. So people do become happier and kinder together when they get together. But I guess the thing, coming back to your point about the last 2 years, well, first of all, COVID has had a huge impact on people being able to do this. All of our face-to-face volunteer-led activity closed down in the pandemic, and that was dreadful, actually, really upsetting and really hard work to respond to. But it drove everybody, as you all know, onto Zoom and other platforms, and it encouraged a lot of innovation. So we launched a new digital program that people can do by themselves, and there's a fantastic new version of that just gone live. If you go to 10daysofhappiness.org, free 10-day evidence-based action program, 80,000 people have taken it, seems to have really substantial impact on well-being, all evidence-based. But we also allowed our volunteers to run these local groups via Zoom, so it's face-to-face still, but it's on screen. And actually they were remarkable in terms of people still wanting to get together and actually reaching people who didn't come to face-to-face things before because of social anxiety, maybe too much geographic distance. Maybe someone recently said, I love these Zoom sessions because I can't normally hear when I'm in the cafe or the local community centre, but I can hear when I'm on Zoom, which is a nice insight. So that actually led to, there's been many disasters of COVID. One of the upsides, as well as, I think, people talking about mental health a lot more, which is a big upside of COVID, we have also seen a 10-fold increase in people engaging with some of these initiatives because it's become more accessible and more people are able to access them digitally. But I think the one message I wanted to leave, which I'm sure is reflected in all the fantastic work we've heard about here on the panel, is that I don't think the problem we all face to create a happier world is not knowing what the right actions are. The problem we face is helping people change their behavior. Knowing that good relationships, being physically active, having a sense of resilience and being mindful, that's fairly straightforward. Building it into your life is really hard. And so we now think a lot about the user journey, as we might call it, which is how do you grab someone's attention? Turns out a calendar shared online on a notice board is a pretty good way of getting millions of people's attention. How do you then bring them on a journey? So we now have regular webinars with expert speakers that people come to every couple of weeks. We've had over 250,000 people join us live on Zoom in the last sort of recent months for these events, which is quite remarkable. And then they might go a bit deeper with this digital program I mentioned. And then what we really want them to do is to come to a face-to-face experience and have ongoing monthly groups, which are now running in hundreds of locations around the world, following these monthly themes. But people aren't ready to go straight there. They say things like, well, what is a wellbeing group? What's a happiness course? I don't know what that is. But if they've been brought on this journey, they're ready to make that change. So my challenge, I think, to all of us is, how do we understand behavior change as much as how we understand wellbeing interventions?
Excellent. And a lot of your community ends up going to the World Happiness Summit, which makes perfect sense, I guess. Something that we were talking about before, which to me is really exciting, is that it ripples out, right? And so where you have people that perhaps were very low on well-being and happiness, then they go through the process of learning and taking action, and then it fuels their actions further to then help others and increases a sense of altruism and to bring this beyond the self, which is what we want to do with the communities that we're all co-creating. Jonathan, what does a well-tempered city look like? What are the attributes of that?
It's, rather than go through all the attributes and give a long talk about it, I would just say that, so I'm going to give you where the idea came from. Okay. So Bach wrote this amazing piece of music called The Well-Tempered Clavier. And the Well-Tempered Clavier was actually, what was interesting is that before the Western music was it was tuned in a certain way so that every scale was separate, and a tuning system came from China and came to Europe in the late 1680s. We created this thing called temperament that allowed us to tune things in a way that you could then go from key to key to key and integrate them all. And at the same time, the clavier was invented, and the clavier was the forerunner of the piano. And I view this as having a software and a hardware, new hardware system, new software system, that then unleashed Bach to be able to create this extraordinary music. And his vision was actually to take, because he was a deeply spiritual person, a vision of the entire universe and its magnificent architecture and represent it through this integration of music. So the well-tempered city does the same thing. The well-tempered city aspires also to take all the magnificence of nature and the unfolding patterns of how the real world really can work at its very best, which we see all as individual segments, and using technologies and new operating systems actually figure out how to integrate them into a co-emerging magnificent whole. So it's a place that you would really want to live, and where nature would also thrive. And this all sounds very hypothetical. So then, but the idea is how do we actually practically implement these things? Anyway, the book draws on a lot of very practical ways to implement these, and there are places around the world where these ideas continue to thrive.
Fantastic. So it's about being in alignment. I don't want to monopolize of the questions. I know that we have an amazing, esteemed group of people here. So I'm opening up the floor for questions.
I can just say one thing.
Yeah.
Absolutely. Yes.
I wanted to just comment on what Mark was saying about the data. And while data is actually very important, I know this is the big thing here for the conference, we like to say that we're data-driven, but we're also data-informed. And what we mean by that is that we don't have to have perfect data in order to start the process, right? And to get going. So sometimes, they say the enemy of, good is the perfect or whatever. And so we are driven by data, but we are also informed by it, and we have enough oftentimes just to get the ball rolling. And so I just wanted to sort of say in terms of the practical application of this. And then the other thing I just want to say real quickly is that we also focus, we're known for focusing on the community, but we also focus on individuals as well, because I agree, we have something called the Blue Zone Challenge, which is really directed at the individual. How do you do those kinds of things that we all know lead to well-being, such as kindness, forgiveness, gratitude, those kinds of things into your life that we know can lift the individual. And then you're doing this in the community so that the community then surrounds and supports that individual as well. The combination of those things can be very powerful.
Fantastic. So I think right here in the front.
Okay, so my question is wanting to hear all of your thoughts on the process of engaging the community to co-create, especially if the community does not understand that, yes, there are certain changes that needs to be done. Where do we start? If we are going to measure certain attributes to show them data, yes, we need to change greenery areas, we need to change social cohesion, etc. But they don't have that trust. So it was like, oh my God, there's another survey. How do you engage people to have the willingness to co-create and be eager for that certain change? And the other part of the question, how do we sustain that change? I guess that question for you, sir.
I'm happy to start. I think what silver lining of COVID perhaps is the intentionality around that at least I'm seeing among local elected officials, right? That the community has to not just be at the table, right, but be co-designing. And I think Tacoma was one example, right, where they went to the community and said, what do you need? From Roanoke, Virginia, little south of Washington, D.C., where I live, it was all about establishing trust. Public trust has really been eroded through COVID, and so I think there's a recognition of the need to establish trust, especially in communities that really have no reason to trust that people have their best intentions at heart. So, I think what we're seeing sort of happening around this community co-creation is things like using the data in one example to fix streetlights, right? Fix sidewalks in neighborhoods, right? Build some credibility with the community about investing in things that they've been asking for a really long time. So that American Rescue Plan Act money in some of these, situations like in Roanoke, that's where they use that money to establish credibility and trust. And now they can have a deeper conversation, and they're working toward what they call equitable budgeting, right? Trying to get the community more engaged in those budget allocations. And the American Rescue Plan Act is an outlier because those dollars went directly to cities. In the US, most of it goes through states and then trickles down. And it's really hard to get transformation because a lot of those federal funding streams in the US come with very specific parameters about how the money can be used. And so that pushes all the burden down on the local communities to figure out how those funds need to work together. And so by engaging the community, when cities are doing this work, they need the political will, yes, of mayors and local council members, But the community gives them the credibility for why they're making those changes. And I think that's what's different now than before in terms of the trajectory, at least that I'm seeing with the cities that we're working with.
Thank you so much. We started a little bit late, so we're going to have to take the rest of the questions maybe at the break. So thank you so much, everyone. Jonathan, Dexter, Sue, Mark, for your amazing work.
Thank you, Jen.
So, and thank you for sharing with us today.